Hello, my name is Anaya Webb, and this is my week 5 return to demonstration lab video over the thorax and lungs. So for this video, I do not have a patient, so I'll just be using myself and explaining the steps that I would use as far as inspection, palpation, and auscultation. So of course, to start this examination, I would, knock on the patient's door. I will enter the room and I'll perform hand hygiene. I will start off with AIDED. I will introduce myself to the patient. I will let them know that I'm just going to do a quick assessment over them, of their thorax and lungs. It'll take about 5 to 10 minutes, and I will thank the patient for participating and cooperating as I am completing this examination. So, of course, my patient will be in a gown, shirtless, so that I'm able to palpate and auscultate correctly. So, of course, I will start off with the inspection of checking the patient's AP diameter. I would look at the patient and check for if the patient has any type of barrel chest or kyphosis or scoliosis or anything in that nature. And if everything is normal, I will state that there is no deformities or barrel chest. I will also check and look for the patient's respiratory rate, and a normal respiratory rate is between 16 to 20 breaths per minute. So if their respirations are normal, I would note that their respirations are normal. They're 16 or 18 breaths per minute, and they are even and unlabored. I will also look at the patient and check for if there's any respiratory distress, if they're having any type of nasal flaring or any type of use of their accessory muscles. And if there's no abnormal findings in that, I will note that the patient has no respiratory distress, there are no use of their accessory muscles, and there is no nasal flaring. I will also state that the patient, how the patient is sitting, I will state that the patient is, their positioning, if they're sitting upright, if the patient is erect. I will also look for the patient's skin tone as I'm inspecting. I will see that their skin tone is noted to be even throughout. And I will also check for there are no signs of cyanosis on the patients, like as far as their sclera, their conjunctiva. I can see that on inspection. So next I will palpitate, and for this particular part, I will check for the patient's chest expansion. So what I would do is I would place my fingers on their back in this position, and I would have the patient breathe deeply. I would have them inhale and then exhale, and as they're inhaling, my fingers should move symmetrically out. So that's stating if my fingers are moving symmetrically bilaterally on both sides, I would state that the patient, that their chest expansion is symmetrical. Next, I will also check for palpitation. I will check for tactile firmitus. So with that, this is all over bare skin. So with that, I will have the patient say 99, and I will take the palm of my hand, the base of it, and I will kind of place it on their back like this. And as they're saying 99 on each side of their chest wall, it should be a bilateral vibration as I'm doing it, on each side of the chest wall. So if that is normal, there's no abnormal findings with that, I will state that there are no signs of tactile firmitus. I really say that they have a symmetrical tactile firmitus. After that, I can palpate, to make sure there's no masses or any tenderness on their chest wall. I will also check for their capillary refill. So with that, you just kind of just press on their fingernails, and their capillary refill should come back within 1 to 2 seconds. So I would do that and make sure with that. Lastly, I will also take their lung sound. So of course I will have my stethoscope, and I will listen for to make sure there's no signs of wheezing or rales or rhonchi. So I would just check for any abnormal breath sounds, and I will make sure that they're also bilateral on each side of their chest wall, making sure that I'm getting normal sounds. And if there are no signs of abnormal sounds with that, I would notate that, you know, upon auscultation that their lungs were clear bilaterally. Once that is done, I will end the I will end it with Roth, and I would, you know, of course, I would reassess the patient for pain. I would, you know, ask them, is there anything that they need me to do? I would offer comfort measures. Of course, I would thank them again for participating as I completed my assessment. And of course, I will, you know, let them know that if they're having any issues, to always come back in, give us a call. You know, don't ever hesitate to come back in for help. So once I'm done with that part of the Roth, I will, like I said before, I will thank them for participating, and I will end it with hand hygiene before I walk out of the room. Thank you.